Hi, everybody. Thank you for joining us today. It is great to have such a varied group of hospital roles on the webinar on loyalty programs and how they can work at health systems. Now, I will say that this is the first time we've run this webinar. It's been extremely popular, almost actually reached capacity. And I haven't done it before, so I don't quite know how long it's going to take. I typically aim for somewhere between 20 and 30 minutes. So just for your timing and expectations there. Okay, so let's start looking at why companies in general deploy a loyalty program. The most obvious really is to retain customers. Customer loyalty programs can really help you keep your existing customers, or in the hospital's case, patients, engaged, which plays a huge role in how likely your customers are to stick around and how much they're going to spend. Next, we have customer referrals. If your customers are able to enjoy the benefits of their loyalty program, they often tell their friends and family about it, which, as a side note, is the most trusted form of advertising. I'm sure any marketing people on the phone know this. It's much cheaper to retain customers than acquire new ones. There are a lot of studies out there that show this. And depending upon your industry, acquiring a new customer is 5 to 25 times more expensive than retaining a current customer. Next, we've got user-generated content and reviews. So if you think about how we rely now on complete strangers and what they say about hotels on TripAdvisor or products on Amazon and how it influences our purchasing decisions, customer loyalty programs that help you to incentivize reviews on websites and social media can really build trustworthy and authentic user-generated content. So here I'm just going to paint a picture on loyalty programs in general, some of the most common types at least. Many of them you're probably familiar with and you use them regularly yourselves. But as I walk through these, I really want to encourage you to think about how they might work at your healthcare system or your hospital. Firstly, we've got a membership program. This is mostly what we see at hospitals now. It isn't really a loyalty program as it's open to anyone who wants to join, and everyone receives the same kinds of benefits regardless of how loyal they might be. We'll walk through some examples of these in some later slides. This is a very easy program to implement. It's used mostly as a way often to try to get customer email addresses versus loyalty type rewards or loyalty type behavior. Next, we have frequency. So this is the old school punch cards, buy 10 coffees, get the 11th free. If anyone has used hotels.com, this is how this site works for those of you familiar with that. So hotels.com is something I use frequently when I travel for work because it doesn't matter what brand of hotel I stay at. Regardless, as long as I book it to them, I get my 11th night free. So in the context of health systems, though, it is difficult to really consider how this would be beneficial for things like physician visits, where you really don't want to reward unnecessary visits. But for those of you with health centers, wellness services, or other ancillary businesses like pharmacies, these are also pretty simple and easy and tactical to implement. Next is points. This allows your customers to earn points based upon the value of their transactions. So it's another simple program. It is rare to come across one that's just points alone. Often they're included or combined with a perks program. These programs tend to be most appreciated by price-sensitive customers. The best example here is Southwest. Southwest does not have a lounge that they can push you towards. They don't have a first class that their members can strive to be in, but they are somebody that will use the dollars that you've spent on their previous flights and reward you with free flights in the future for that. So it's also how Walgreens uses their loyalty program. I'm going to spend some time on that later. But when you look at points, again, it's something that I think hospitals could be increasingly looking toward to encourage healthy behaviours in the way Walgreens does, particularly as we move towards a value-based care world. It's also particularly relevant to those of you that have your own health plans, how to promote behaviour and reward your members with points for certain behaviours that make them healthy. Next is the tiered loyalty programs, where customers receive benefits that include both discounts or money back, but also the ability to climb to a higher status. So think about airline miles here. I'm a frequent user of a few different airlines, so when I travel for work, right now I'm about 900 points shy of my silver status. So this means that on my next flight, as long as it's price comparative, I might actually be willing to, have an extra layover to fly Delta, because the silver benefit is pretty good. Priority boarding, free upgrades. This type of loyalty program can be very effective. In a recent survey, more than 50% of respondents said they increased spending or changed purchasing behavior in order to achieve a higher tier status in a reward program. These are appreciated by customers who are less price sensitive and tend to be more attracted to the perks and the upgrades. Again, in putting it in the context of healthcare, it is difficult to see what perks you might be able to offer. If you think about doing a skip the line at your urgent care for members, you can maybe imagine some pretty irate parents who are in the waiting room as they see somebody walk in before them, or maybe there's a special lounge offering free food and beverage at the hospital. A later slide will talk through some of the perks that some health systems are looking to reward behaviours and loyalty with. Next is fee-based. One of the prime examples of a fee-based program is probably Amazon. I think that everybody I know pays an annual Amazon Prime fee. They probably couldn't even tell you how much it was because they love the 2-day free shipping. I know the fee again went up last year, and regardless, we still do it, and we will choose Amazon over other online sites because of the 2-day free shipping option. You also have Amex and Amex Platinum. A lot of people happily pay a fairly extreme annual fee of, I think, close to $600 for a range of perks, particularly airline lounge access that the Platinum card gives you. Finally, cashback, less relevant, I think, for hospital systems. Discover Card, probably the most well-known of these programs. Cardholders automatically earn a 1% cashback on all purchases they make. I think the takeaway out of this slide should be there's a range of different programs trying to think about how they fit into healthcare, and what customers you want to attract is, really up to your customers, who they are, and what your goals are. In most studies, though, the general conclusion seems to be that a combination of programs work best as they can cater to multiple types of your consumers. So let's talk about the kinds of businesses that tend to benefit from loyalty programs and how healthcare aligns. Higher margin products and services, generally anything over a 10% margin, tends to fit well with a loyalty program. Healthcare services falls into this bucket. Products and services that people buy frequently and over a long period of time. Again, healthcare falls into this, as physician visits and ancillary services like the pharmacy are common purchases or activities for most people. And then there's products and services that are not unique. And that is where your competitors offer similar services or products to you. Again, healthcare and hospitals fall into this. And while hospitals, tend to try to make their superiority of service or physician experience known through marketing, at the end of the day, most people choose their doctor based upon word of mouth, convenience, physician-to-physician referral, or who's in their insurance network. So now we're going to walk through a few examples of what some hospital systems are doing, most of which are membership programs, which are easy to understand. I just don't know that they're as effective as they could be, and we'll think through some of the reasons why. So the first one here is a hospital out in California, Paradise Valley Hospital. They have a program that welcomes members with a welcome gift, provides discounts across their retail outlets, places like the cafeteria, the pharmacy, the gift shop. They work with local hotels to provide discounts to their members, and also have VIP parking. They offer some really nice benefits for inpatients as well, with the ability for a private room upgrade if and when available. The main outcome from this program is using the membership card as a way to drive their hospital as a preferred location because of the perks that the patients receive. Next is two more loyalty programs or membership programs. One at Bay State Health, which really targets the senior population, and the other one's Botsford Hospital in Illinois. Again, very similar, but with fewer perks than the previous slide. These are also free to sign up, provide discounts at on-site retail, cafeteria, pharmacy, gift shops, etc., as well as local vendors. The parking benefit seems to be a common theme through all of these. The final example here is Baptist Health in Florida. This has built a loyalty program around targeting employer groups versus the customer. In this case, the employer would sign up for the program, which, really when you look at what's included as part of the program is very similar to the previous programs in regards to their benefits, but the employer is signed up and the employees are then rewarded through this membership enrollment. So now we're going to move on to discuss some of the steps that you might want to try to take when deploying or designing your own loyalty program for your health system. Here, really, and that's what I'm going to be walking you through, is the 6 major steps of starting with a business plan. Step 1 is you need to understand your healthcare consumer. We'll walk through a lot of this as we outline the needs, wants, and desires of each customer segment and how it could relate to a loyalty program. Quickly on this slide, as you all probably know, high deductible plans are changing how we shop for healthcare. So to give you actually a personal example that I've spoken to hospitals about in the last 2 or 3 months that really seemed to surprise the C-suites is I have a great health plan, but my enormous downside is it includes a $7,500 deductible. So I'm very cautious about who I see and how much things are going to cost. So I recently had to see a podiatrist about a lump on my foot. After he took some x-rays, he evaluated the lump, told me, look, it's just a cyst, it's not cancer, nothing to worry about, but let's get some follow-up treatment to have it go away, and that'll cost about $300. Now, this thing doesn't cause me any pain. You can barely see it. And so I said, no, thanks, I'm good. I can live with it. It wasn't worth the $300 to me. However, in the past, when this would have been covered by my insurance or would have been a much lower copay, I would have definitely moved ahead with it. So shifting loyalties around your own out-of-pocket expenses and driving that benefit to your loyalty members can really drive great engagement. On top of this, you have a huge population of millennials that are starting to emerge as patients, beginning their healthcare journey as they have babies, start families. Unfortunately, these are generally not loyal customers to any industry. And, they're not the kinds of customers that the baby boomers were that, listened to their doctor, did what he said, and didn't go anywhere else. This generation is looking for convenience. They're looking for superior experiences and superior access at lower costs, and they will shift their loyalty to a competitor if they offer that. So this is a group where a well-structured loyalty program can really benefit you and healthcare providers in general. So let's go through some of the most common patient segments as a way to identify the patients, and then we'll talk about the kinds of loyalty programs that might best attract them. So starting here with the fitness trackers. This segment wants digital content and services that help maintain a healthy lifestyle. They have a preference for alternative approaches to healthcare, but are also a group that's looking for cost alternatives to manage their health. They will pay for convenience over high-touch care and generally are fairly low-cost users of the system. Next is the Invested Informed group. Now, this Invested Informed group is also the group that is most attracted to loyalty programs and use them the most. They place a lot of trust in websites to provide reliable information. They stay engaged by looking for informed and preventative solutions, and they will pay for what they believe them and their family needs. Next is the Corporate and Content group, generally a tougher nut to crack on the loyalty front. They have the incomes to pay for care, but generally don't want to pay more for better benefits. To gain access to this group, it's important to show them that you're providing value, that your wellness programs work, that they're available to them. Often the unwillingness to pay for it, though, could mean that you have to bundle these as part of a broader program or show ways to show them extreme value. Next here is the healthy and subsidized group. Traditional Medicare type patients tend to be good patients, are loyal and value their physician's advice. Apathetics, this segment doesn't generally add a lot of value to a hospital's bottom line. They can't afford to pay for much by way of out-of-pocket expenses, but they tend also not to be high-cost users of the system. The important thing about this segment is to work out how to begin educating them earlier in their process so they don't become the next segment, which is the frugal patient. These are the very costly patients that can really blow a hospital's bottom line in a value-based world. It's important to develop programs that keep these patients healthy so they don't show up in your ED. And the goal of these patients is to develop programs that drive down their costs and your costs, and when possible, look for ways to be paid or reimbursed for programs that provide loyalty points for certain behaviors. Now, this segmentation is just one segmentation. It was done by Forrester Research. There's millions out there. This is just one that I happen to choose to outline the kinds of patients that are probably within your hospital system and the kinds of things they look for. So step 2 in the business plan is looking and recognizing what your goals might be and how to define them as part of what you want to achieve through a loyalty program. So patients have more choice than ever. They have new front doors through telehealth providers, retail clinics, and urgent care. You have other providers, large healthcare systems that are being acquired or merging and really using their enormous budgets to drive patient acquisition away from their competitors. And you have self-care. So this is people who look online or to digital solutions for their own care versus seeing their physician. One statistic I saw wrote that 1 out of 20 Google searches in the United States are on health-related topics. So further on this point, the majority of the population that are major users of these self-care sites are that same invested and informed group that are also very engaged in their healthcare and tend to be the biggest users of loyalty systems. So it really comes down to understanding your consumer, their desires, and then looking at how your organization can fit in with those goals and what you hope to achieve. It's important to outline the most important aspects of your loyalty program and what your targets are. I'm sure that these all would be great, but it's probably important to rank them in terms of importance. So improving patient health, attracting new patients, retaining existing patients, driving new sources of revenue, or lowering your patient cost of care. So again, I'd guess that the majority of you would choose some or all of these when designing your objectives. And as we finish up the presentation, I'll talk through each of them and how they can be tied to a loyalty program. So back to that customer segmentation and a summary of how a loyalty program might be able to target your high value and lower value customers. Higher value patients can really drive revenues. They can drive service adoption while also being great referral sources. These groups are great marketing targets of where you can drive your awareness of your premium clinical specialties, areas like cancer care, mum and baby, and wellness. If you think about things like offering free or discounted daily monitoring for mums to be, for fetal heart rates, for example, for those mums that are going to be delivering in your hospital, it's a great benefit that can really drive the referral, give mum peace of mind, and know that they're getting something extra for being loyal to your hospital system and having their baby there. This group is also very receptive to mobile and email marketing for reach and engagement. There are some ways that you can engage, reward, and incentivize any out-of-pocket solutions around health and fitness, both dollar spending as well as personal health care rewards. This group is also very receptive to digital healthcare solutions for convenience. So having members of your loyalty program be able to use points for discounts through telehealth or automatic discounts for your telehealth offerings or your retail clinics, is also something that's going to be very attractive to them. These are the people that will spend out-of-pocket dollars for convenience and are looking for lower cost solutions and ways that you can help them through things like a loyalty program. Next, you've got your lower value patients. So if I was a hospital system, I'd be looking to these patients as a way to incentivize certain behaviors to lower your hospital's out-of-pocket costs for taking care of these kinds of these patients. These are a great group for incentivizing behaviors, prevention and wellness items, especially in cases where you can be reimbursed for it, things like chronic care management, for example, or transitional care. There's another CPT code that could probably bring about $100 a month in per patient for remote monitoring. Digital healthcare and telehealth solutions, another great way to try and lower your cost of care for this patient segment. Finally, this group here is the kind of group that are receptive to rewards that lead to discounts on health and wellness items and over-the-counter products that they have as part of their daily living. Next, I'm going to walk through something that Walgreens has done because I think it's probably a great way to talk about how healthy behaviors can drive rewards and points. Walgreens' goal was to grow their brand so that it became part of the general consumer healthcare conversation. They wanted to move the customer perceptions from being a place to go to get medicine when you're sick to one of Walgreens being a total health and wellness destination. So to do this, they adjusted their loyalty program and really restructured it to focus on member acquisition to one that's more wellness focused by offering free rewards for healthy activities that are conducted outside of the store. So for example, if a member connects their step counting app, their Fitbit, to their Balance Rewards account, they earn rewards points for walking or running. So for the customer, it's an incentive to be healthy, along with a reward for being a Walgreens customer. For the brand, it's a way to improve the experiences for the customer, while also expanding Walgreens' digital presence. So the strategy really had two approaches. One, it was to educate and inspire existing members on new ways to earn rewards so they become more loyal to Walgreens. They're more engaged with their app because something they do every day, like walk or run with their Fitbit, is now recorded and uploaded to the app. And the second thing was to connect with and sign up non-members who are using fitness devices and apps for healthcare. So it was also a member acquisition strategy. The results were significant. Balance Rewards is now the largest loyalty program in the world. They have more than 100 million members enrolled, more than 200,000 devices or apps connected. They've had more than 120 million miles logged into the program and more than 2.2 billion Balance Rewards logged. So it achieved everything that they were looking for. Step 3, probably the most important step, is understand your constraints and legal implications and how important it is to be compliant with anti-kickback laws. You don't want to end up in jail because your loyalty program is not structured correctly. So the federal anti-kickback statute, civil monetary penalty laws, generally prohibit offering anything of value to induce patients to order or receive services. However, there are exceptions to this that have been statutorily excluded and outlined as follows. You can provide an item or service of less than $25 a time and no more than $75 per patient per year. This means you're able to give patients financial rewards of $25, 3 times a year and stay compliant. You have incentives that promote preventive care or promote access to care and pose low risk of harm. So this could apply to you providing with fitness devices or remote management devices to help them manage their chronic disease. The provision of childcare, great bonus for mums, but in talking to a lot of hospitals, most of them are pretty terrified of the liability risk that comes along with this one. Technology for reporting data, telemedicine capabilities, transportation, which many of you are probably already doing. And finally, probably the easiest area to start rewarding patients, whether it be for attendance or on-time visits to their physician or just showing up for their annual wellness check, is offering over-the-counter pharmacy items or discounts on over-the-counter pharmacy items, discounts at the gift shop, and online dining establishments. Slides 4, 5, and 6 really focused here, steps 4, 5, and 6 are really focused around the implementation and solutions of these digital programs, which brings me to where and how to develop these, and the whole business planning process. From steps 1 through 6 is where people like Q Consulting assist clients. Here is a little about what we do. We really work along what we've defined as our consumer healthcare spectrum to outline the opportunities that are out there for hospitals and the expected ROI. Our recommendations and suggestions will always outline the reason and supporting data behind each initiative, as well as its costs, staffing costs, technology requirements, etc. We can also recommend any necessary partners that can provide the best technical solutions to meet your goals. Just to reiterate here, I think the most important point out of this, before you start running around looking at a loyalty solution, understand your customers and outline your goals. Working with the legal guidelines is pretty easy because they're very well outlined. Then design and implement based upon those first 3 actions. Next steps. Hopefully you are all able to learn something. Thank you again for attending. Please stick around at the end. There's a survey. If you wanted to let me know if you wanted a copy of the slides, if you wanted to set up a call, we're able to pretty quickly help you understand the benefits, if there are any, of a loyalty program based upon the structure of your system, the kinds of physicians you have, the size of your hospital. We've done this many times. Our experience has included working with over 400 hospitals across the country, helping them deploy consumer healthcare strategies. Our clients have ranged from small sites all the way through to the largest healthcare systems. Through our engagement, a hospital has typically been able to find at least several $1 million in new revenues, sometimes for the bigger ones, tens of millions, as a way to really grow their brand, grow their market. Final note here is I'm going to be in Northern California next week. So if anybody on the calls in that market would like to schedule an on-site meeting, I'm happy to do that. My details on the next slide here, if you would like to reach out to me directly. Otherwise, thank you again for attending and enjoy the rest of your week.